I is Elise is Alicia Meyer here?
Yes.
She,
It only said on it together. This is there. Really? Okay. So,
You guys, you're recording at the top left.
oh, it is.
and anyway, before we start, Alicia Meyer is the president of the board of directors for ABC, and they did have a luncheon, their annual luncheon yesterday, and she and her staff did just an amazing job. So compliments to Alicia and her staff. All right, so we will get on with our agenda today. First item is the approval of the minutes. Any questions, comments, corrections?
Second.
Second. Yep.
I have one comment about the active shooter training, which is mentioned there. And this is an FYI with especially in light of the most recent school occurrence in Nashville, Tennessee, that the New Canaan Police Department, they have a policeman in attendance at New Canaan High School, another one at Sachs, and then another policeman who rotates amongst the three elementary schools. They do have a crisis committee meeting monthly to deal with these school-related issues, and Dr. Lutzy feels that we're just about as good as you can be, given the environment and the fact that a lot of these AR-15s and other like weapons are still out there in public. So that's a good thing. And also our Leo Grolakowski, who was our previous chief, John DeFederico is now, he did go to Darien, and he's working on this school safety issue, and that was one of the reasons that he went to Darien. Okay, so no corrections or anything. Motion to approve, please.
Yep, done here. Okay.
Second, all in favor? Aye. One other issue, I guess it's related to the minutes. When I was looking at under new business, our commissioner's activity in the community, and I know we had discussed this, and I just went back to, it was last January. When I looked at that, I also noted that in the minutes was the fact that I was continuing as chair and Alyssa McKenzie was continuing as secretary. There was no reference to Jim Lisher, Tom Ferguson, Russ Barksdale, and Peter Campbell agreeing to continue to serve. So that probably should be in the minutes now, even though it's a retro. And I also want to thank them for continuing to serve.
You can't do that, Harrison. Once the minutes are approved, they're approved.
No, but put them in these minutes. At least the thank you and the acknowledgement. On to reports, Health Department, Jen.
Yeah, Jen Ileson, Director of Health. First, I want to mention it's National Public Health Week from April 3rd to the 9th. So I would like to thank my staff, especially for all their continued hard work, not just during the pandemic, but day to day. Vaccinations have, really dropped off. We're not doing that many anymore. It's just a handful every week. Same with testing, but we still have it available for anyone who needs it. Cases this week, we have 7, down from 8. So again, it's continued to be low, which is, good news, but we are year 4 of this. I mean, 1918 flu, the same thing happened. 4 years later, it finally fizzles down.
Doesn't the government have a day when it's officially over? Like
May 11th.
Yeah.
All that means that date is the end of FEMA. That's it. Nothing else changes. As you can tell by the chart, hospitalizations are really, really low. So that's good news. Another sign that we're finally, hopefully, nearing the end. The farmers market permits have all been reviewed and approved. So that was good news. Building permits are kind of steady, but they're not where they normally are in the spring. And I'm hearing from contractors, they're having a hard time getting construction loans now with all the interest rates and the bank fiascos happening. So that's kind of not good news for revenue purposes, so we'll keep an eye on that and see how that plays out. The FEP, I just submitted the financial progress reports again. The ELC2 grants, the finance director, Ann, and I are having issues submitting because now the state comptroller wants us to use this core CT program. And of course, it is a nightmare. You can't get us in, have an old finance director. And of course, you know, I'm like, can we just go back to the old Excel days so I can get my money? So that, you know, is still ongoing. So finance and I, but at least we know the amount that needs to come out, so finance can fix my budget and put the money aside for that. So speaking of grants, I just got 2 more awarded. One, a workforce development grant for $45,030.29, which we will get that check front loaded, which normally you're doing reimbursement November 30th of this year, and that runs to the year 2027. And that can be used to fund the public health nurses ongoing. So after this year's ELC grant, grant runs out, because that was a concern of mine for next budget season. Not that I have any issue with the Board of Finance or Town Council, but I never like to put more on taxpayers, especially in these times with revale coming. So that is good news that we're fine to 2027. So that, and then the other grant, the immunization grant, is $48,156, and that runs to 2025. Again, you can use nurses, buying supplies. There's a media component to it, with X amount of dollars have to go to the media component. So, we might do a regional media campaign and then, you know, do small amounts individually, because that way we can pool the media part of the money, and get a more bang for your buck. Because, you know, cities like Bridgeport, New Haven, Stanford, they got literally hundreds of thousands of dollars, and X of it has to go to media. So in their own communities, it'd be hard to spend that kind of money, and the state has agreed to let us do it out of a Region 1.
What kind of shots are these?
It's for any immunization.
Flu.
Or anything.
Okay, good.
So the total new grants awarded is $93,186.21. So that's, and there's still another lead grant that hasn't come because of part of all the governor's changes to the legislation about lowering the levels, which is a good thing, just creates more work. So we were promised ARPA money from the governor, and we're just kind of waiting on how they're going to decide, because the way these were decided, they did a couple metrics of population size, and in the workforce development grant, they also went by social equity. So the percentage of people in poverty. So obviously New Canaan's very low on that, so we didn't get obviously anywhere near the money that the cities would get, but that's, you know, normal. You know, next. The health department, thank you, Bethany, for agreeing to partner with us. So the health department of human services are going to be offering a new program called The Matter of Balance. It's a nationally recognized program. The Fairfield Health Department hosted the Train the Trainer. So Shannon and my nurse Ellen and Enza from Human Services all got certified. We already scheduled classes to begin at Lapham on April 19th through the 17th. Aggie has agreed to handle all the registration for that. You can only have a limit of 12 in the class because you're supposed to be focusing on their actual moves and obviously making sure none of them hurt themselves in this. The number 1 reason of emergency department visits in the country, according to CDC, is falls. So this is a part of, you know, the national picture and the state health improvement plan on reducing falls and, again, preventing issues. That's what public health is about. We inspect restaurants to prevent, you know, foodborne illnesses, etc. We also plan on wanting to do this at Schoolhouse because they don't have vehicles, but they have a little conference room down there. Shannon's already spoke to Peggy about it, and the age demographic is 60 and up. So we're looking to there. Shannon also reached out to Katarina at the inn, and possibly also in Millport, and it's just going to be an ongoing thing and free of charge. And then the nurse, can go over medications with them. Some medications make you, lightheaded or whatever. So
they're actually running the program, Shannon. So they're doing exercise.
Yeah,
that's great.
And then there's going to be another component in the future that's actually not part of this, but it's tied into it. I've been speaking with the fire marshal about in the fall. He always does, installing fire detectors in people's homes, especially seniors. So I've already spoken to him about sending, one of our inspectors out there. And as part of this, looking for hazards in the home of, trip hazards and stuff like that, because that's even EMS has said the number one call they get are lift assist. So if we can start, helping on our end, it would be great for everybody. So again, thanks, Bethany and her team.
You should be in touch with Staying Put. They might be interested in looping in on this program as well. So.
Yeah.
I think the one issue that I've seen is people don't want you in their house.
Yeah.
Yes.
And you look in and there's lots of papers piled on, on the table. And
well, of course, they would have to consent, just like our homebound vaccinations. Right. Some loved it. Others were like, no, come to my house. Yeah. And then it's like, okay, so
But maybe EMS will have, it's a great idea. These falling is, in those houses.
Well, and with the fire marshal then putting up the smoke detector and stuff, you also don't want clutter and obviously you have the right to live the way you want to live in your home. This is just offering, if you want the help.
It's great idea.
Yeah. So I think it'll be great. We'll see how it goes, and it's a total of 8 sessions for each course and 2 hours long each. So we're excited about getting that going. Aggie said right now they're kind of in the middle of what they call semesters. So over the summer, she'll have a lot more room. And the seniors are more here in the summer because they're snowbirds. So that also works out. And then the budget process is complete. They were voting last night. Nothing I don't think happened on our end. Okay. So that's good news. And then the PD did a stop the bleed training that my entire staff went to, Bethany's staff went to, and that was phenomenal. Really is.
What is that?
They teach you how, if you come upon, say an accident or something, of when to pack a wound and when you need like a tourniquet. And it actually was very eye-opening, and now actually I do feel confident of, obviously, it's only in those dire situations where they saved a man's life on Old Stamford Road by putting on 2 tourniquets. Because you only have minutes in some of these things, but so the PD is really expanding this training program, especially for public works and all these departments that use heavy machinery. So that was great. But we also attended a workshop at the Connecticut Ag Station about the emerging tick diseases and new mosquitoes and everything else. I mean, we forget before COVID, Triple E was the biggest hysteria. I miss those days. And then lastly, I just wanted to mention, this isn't my program. I'm just helping Janet get people for it, Janet Reed. The public schools are doing a great program on April 25th. They have over 400 signed up already for, it's called In a Heartbeat. They're a private nonprofit. It was founded in 2015 by Mike Capale, I don't know how to pronounce his name, whose son ended up going into cardiac arrest at a game. So what they offer, this organization, they come in and do free ECG screenings, because in that age group, pediatricians don't tend to do that because insurance doesn't cover it. So if they can save 1 life, that's what they're due for early detection. And the fact that we have over 400 signed up for it is great. And, you know, hopefully.
Is that the high school?
Yep.
So do we have defibrillators at each? I know we have them here. Is it at the high schools as well, especially around the gym and things of that nature? They exist there.
Yep, and then if they didn't, this organization also provides those.
Okay, good.
So they.
Harrison, would that pick it up if a child had a latent risk for heart issue that normally you wouldn't expect at that age? Would an ECG pick it up?
Yes, it will pick up most things, but not everything. Some things you need an echocardiogram for. And there is, it's also a lot of dependence on the interpretation. There are pediatric cardiologists involved with this program. Its genesis was from an individual who had a cardiac situation as a child and survived it. So he's funded this and moved on with it, but they've had it in Wilton, they're having it in New Canaan now, and the numbers just shot up 400. It's a great thing to have because it will pick up some congenital predisposing abnormalities that can be life-threatening.
And it'll also give you the baseline to have on file. Like, I'm sure many of you, when you go to your, primary care every year and you get your EKG, you can go look back yourself and see if there's anything. So I think it's phenomenal, and it's a wonderful organization. If you're interested, just go on inaheartbeat.org and it'll tell you all about them. And, if you, and see where they put in and everything, and they're great. And they accept donations, obviously, because they're all a nonprofit.
Thank you.
Thank you, Jen. Next, Human Services, Bethany Zarrow.
Hi, everybody. Bethany Zarrow, Human Services. This month's notes have been mainly with Jackie and Marcy have been working extensively on these caseloads. They're incredible, and each one just is very complicated. And the hours they spend, you gotta love what you do when you try to come up with resolution and resources and things like that, and the patience. We think we see a right answer, but if the person does not want to get involved with possible resources, it's very hard, but you gotta step away. It's their choice. The right to self-determination definitely gets in the way of recovery sometimes. But they work endlessly on that. In terms of the department itself, programs, let me see, the budget presentations are done with Jen. Jen and I did the Health and Human Service show, a number of presentations, and that worked out fine. Continuing with the New Canaan Urgent Assessment Program strategy for funding, we can, I think, comfortably say through Silver Hill, we do have a verbal commitment with Weston that they will come in at some monetary value. So that's good. Partnering with the New Canaan Police Department, it's been incredible for the caseworkers having to go out with state agencies on site and just having a safe protocol that we follow. So that's been working out very well. I'll pass this around for the Human Services. This is the resource card we're thinking of doing. Look at it, love your opinions, and we will not be doing this. This will not go to print until July 1st. So there's time, but we want to get it going. And a number of programs we continue, the farmers market and food pantry combination. Food pantry clients will receive vouchers for the summer to be able to utilize the farmers market, which sometimes is more expensive for the fruits and vegetables and honey, things like that, but that's proven to be a very successful dietary outreach, so we'll be continuing that. I've attended some Voices of Resilience for Grief and Memory. I've completed the grief counselor certification, and now I'm beginning the grief practitioner certification, which with emergency response and health department would be responsible for human services for the family assistance center, that in the event there was a mass shooting or in the event that there were deaths in the town, this would be a center where people would go, not as a public outreach, but if someone were missing or definitely had passed, things like this is a place where they can go. It would be open like from 8 to 5, and it's a state. Hand it over to the health department gets everything, but it would be Russ Kynes, who's in charge of emergency response, would set up this crisis center, and so we're starting, just dusting off the plans from the state level and tweaking it to our community level. So
how do we integrate with the faith community?
So what we had, what I felt was necessary was time is needed for compassion and non-judgment. So Jen Zonas, who is the co-director for Interfaith Council, which is comprised of the faith-based community in the area, and it's comprised of laymen that come together and to understand and cohabitate with all the different wonderful spiritual religions in the world that are in New Canaan. So we felt that Interfaith Council is a great dissemination point for the faith-based communities. So she has agreed that she is going to work with us, the Interfaith Council, for these family assistance centers.
And they're gonna help us with the plan on the back where it goes through every religion. And then it goes through like specific dietary needs for
the culture,
all the culture part of it.
competency aspect.
So they're all gonna be helpful.
So very excited about that, and brought them on, and clergy will be brought in too.
I know.
So it's very, very good.
Yeah.
Exactly, and the fact that we're doing this hopefully makes you
I know, you feel that way about everything you're saying, it's great to have it in place, but.
Yeah.
Right.
Bethany, you mentioned that Marcy and Jackie are spend a lot of time on individual cases. Which is, a major value add for our Human Services Department. Do other towns and cities spend comparable time with their residents who need help? Are we exceptional, or are we just?
You know what, it all depends on Human Services, the resources they have, and we've done such partnering over the past few years that we do have quite a few resources. And so it's getting in touch with them. We also are doing a soft, gentle handoff, like the Silver Hill, the New Canaan Urgent Assessment Program. We've made these partnerships and contacts directly so we can discuss. And the resident, the client, is also feeling very comfortable working with us and extending the care and the inclusion of the counselor with other aspects of their wellness or their pathway to having a stronger positive outcome.
While you're answering, what on earth is the Blight Committee?
So the Blight Committee,
Overgrown grass,
there's a process.
Knocking on your door later.
There's a process in the town charter that in the event that it's a neighbor of yours that you can see, and if it causes some type of anguish, there's a definition of it. Unsightliness, what the definition is, there's a few definitions. And so a resident would write a letter to the Blight Committee, and Brian Platts is in charge of the Blight Committee. Yeah,
The town committee.
it's a town committee, and then the committee members, such as myself, we read the letter and we look at the definition of blight. We see if this is definitely a matter of blight. And if it is, then it will be a case that will go to the Blight Commission.
Loud music is cool.
No, that's under the noise ordinance.
That's an ordinance.
Every town has a different blight ordinance.
Yeah.
Only this time.
Is it always?
Yeah, when I worked in Bridgeport, we did the blight inspections to help.
Like, I can see why help would be because of like.
If the grass is overgrown, you have grass or.
Brian asked if I would be on the committee.
Bethany lives in town, but also Human Services, sometimes it's because it's an elderly person and they don't have the financial wherewithal. So we used to, try to help them connect with a contractor who likes to do pro bono work and.
Yeah, we do that. Brian has an unbelievable resource center. So sometimes it is a client, other times it's not. but it benefits the resident. If there is a need, we are definitely in touch and have a rapport with them. We can help.
And you can.
It's not to punish, it's to help.
Well,
It's to help the neighbor.
there is a punishment piece of by statute, $100 a day. So those that specifically choose not to do it, when they have the resource, they start getting fined, then the property's lien, and then the town can get the money back that way when the property's sold.
But hopefully it never gets.
Yeah, we've only had a handful in the 9 years I've been here to get that, to that point.
5 years, I never heard of late.
It's always been a thing,
Charter.
There was a big Canaanite story in the last couple of years about like.
Some towns have the play ordinance where it's specific, that if your grass is over 6 inches or, you know, whatever.
Wow.
Okay, so the ongoing training for Medicare Savings Program applications, Marcy and I are continuing the upkeep of our knowledge for this. And Human Services will now work with Officer Cece, who's our Community Impact Officer. And I'm going to be speaking at roll call in April just to strengthen the bond between all the officers and being able to have a stronger rapport so they know the outreach with Human Services and potentially the residents they come across. And
can I ask you a question? Take Me Home, what was that?
So Take Me Home is the program. It is nationwide. It's called Take Me Home, which mainly it's geared towards those with dementia, wandering issues, as well as those with special needs. And it's having access, the police department, access to a photo, information about what can calm the person or what's going on actually. And so in the event that someone is, police are called because someone's walking through traffic and flailing their hands or walking like incoherently along the side of the road, very often with this additive, this information that they already have, the situation can be de-escalated much more quickly and with compassion and things like that. So they, at the event, there were a few people, you know, primarily with those with special needs that are really not communicative and able to tell what their address would be. And so it's just a matter of the community coming together, making it easier for those that possibly might be in danger should they get out without any type of aid. What else? The Interfaith Council, that's what we have with the Urgency Assistance Plan. And working with Silver Hill with the Urgent Assessment Program, Human Services, giving them resources to give to their incoming assessment program residents. Continuing the blood pressure clinics, I'm getting referrals, and the telehealth participation list. The website that really hasn't been changed since it was initiated in 2015. There have been so many updates with the host page. It's very difficult now to get on it. And for each person, it's taking a few minutes to get to the website. It's not returning my responses. I think, you know, Jim and I, maybe we can talk to see what should be done. I've spoken with Jim Bell. It's a monetary issue. Do we want to, but maybe you and I can discuss it and bring it up at the next meeting. In terms of it's getting hard for the clients to have access to it as well as the nurse. So I don't know, we'll figure it out.
Right.
And so then you see, Marcy's and Jackie's resource update on their clientele and what the topics that they're discussing, and the Human Services data. Just wanted to give you a year to date compared to fiscal year 2022. We finished our third quarter of fiscal year 23, and some things are very much in equilibrium to 2022. But the increases are the clientele has increased significantly. Domestic violence cases are at really they're 35 were in 2022, we're at 27, probably end up even, but that doesn't mean that domestic violence people are not increasing their outreach. The Domestic Violence Crisis Center has doubled the residents contacting them. So these are only cases that we get from the police that we follow up with. These are not anything to do with confidentiality, as I've said before, privately going to a resource on their own that they know about. So we try to get the resource out so that they can go to it privately. Referrals have doubled. Food pantry seems to be along the same line with about 540 shoppers so far this year. Last year was 750. With the next quarter coming up, should be fine. Everything, assistance and energy assistance this year was up to 51 people. The program closes this month. Last year we had 38, this year 51. Barb, did you have a question or
No, no.
Okay.
No.
And then,
Just
yeah.
so clear, thank you for putting this together. I mean,
Yeah.
it's quite helpful, but just so that we're clear, the fiscal year ends June 30th.
Yes,
Correct. Okay, so this is as of the end of March.
March 30th,
Right.
31st.
And I don't know if it's owners, if it is, don't worry about it. But if we looked at the 3/4 versus 3/4, it would just help, you know, kind of see as compared to I'm sitting here dividing by 3 and adding, you know, 4.
Yeah, that's
You can't let Russ do math in this.
I send you the spreadsheet. When I say spreadsheet, it is spread. So I will send you the spreadsheet.
No, I just wanted to
break down.
when you look at the things that we focus on, like domestic violence, like Silver Hills, you know, great program, just like to see if the needle's moving at all. And with the economy being what it is,
Yeah.
we're seeing, at least for our constituents and people we care for, and even our employees, the impact that the economy is having on them. So wanted to see if there's any red flags or yellow flags
Sure,
that
I
are
will
happening.
send you the spreadsheet and you can just peruse through it, but it's very, very long.
But you would thought, you know, I would have thought, you know, domestic violence cases would have been up. The fact that they're down, maybe is a sense of some of the other
They're
programs
flat.
that we have.
They're flat.
And then you look at food pantry and things of that nature. So yeah, I think it's just a good, you know, looking at what the economy's impact is on.
Absolutely. At the end of the year, I usually give you the whole year into quarters, months. I mean, I divide it into 12 months. And I would give you that at the end of the fiscal year, but yeah, if you want it,
so things like, you know, rent subsidies, or maybe the number of homes that are going for sale now has gone down versus, you know, people were being forced out because the home was going up for sale, things of that nature.
Okay, I don't follow that.
Okay.
I don't look at those statistics.
Yeah, no, but if you looked at the subsidy for rent, you know, that may be an indication of where people are having issues.
Yeah, so, you know, I'll give you the numbers I have, but yeah, I can only, yeah, we'll figure out.
When you look at this in the data, is there any one area that you see that we need to focus on, or you would give a priority that so that we need to, you know, change our priority at this point?
No, I think everything, in terms of resources, this is what Human Services, we are a resource center. We do have some programs, you know, during the year, but we're not large enough of a town to have a program for every person's needs. We just don't have the population. And that's where our resource-based center is for the surrounding area for Fairfield County. And that is how we function on a minimal staff, making sure, and people are very pleased with it. And so.
Have we also, I'm sorry, this is the last question. Have we also received an update yet on where New Bonds' and Norwalk's community assessment report is?
They're doing it completely different this year. They're not including anyone. We used to have subcommittees. There used to be actual like buy-in. Now since it became Newvance and not Norwalk Hospital, now it's this corporate conglomerate that they're taking a cut and paste kind of model to. Like the data I sent you yesterday, you notice the towns of New Canaan, Darien, we're just lumped into this now category called wealthiest community. And to me, that's not helpful. And I've asked repeatedly, and even Peter tried getting the data of our specific town, and we haven't gotten it. So at the end of the day, I'm gonna end up having to just do my own New Canaan specific one because it's not working this way. But you know, I didn't particularly care for the way they're grouping data, or you know, and what the motive is to group it that way.
With a population of 20,000.
We're not a tiny town. I mean, Weston, I get, there's only 6,000 residents, but you had ample responses to be able to get real data out there.
Okay, thank you, Bethany. Harrison Pierce, Chair of HHS. I think it's great that you and Marcy are doing this grief counselor. You were certified and now you're in the practitioner certification phase. It's phenomenal for the town of New Canaan as well as the HHS. And this is an FYI. I don't know if you saw this article in the New York Times by Dr. Puri, who's a palliative medicine physician. And the article was, quote, being ready to die, unquote, is an illusion. He has also written a book, Life in Medicine at the 11th Hour, which may be worthwhile for those interested. Thank you again. We will now move on to old business, AARP competition and grant. Jim Lisher.
Okay, basically the grants both went in early March, thanks to a group of people knowledge in a minute. Basically $50,000 for the urgent assessment program to get more seniors involved, and specifically to run a marketing program to recruit. Right now, 4% of the people taking advantage of that are seniors, and it's depending on which number you look at, 18 to 20% of the population is seniors. Secondly, there was a Silver Hill presentation a couple of weeks ago on geriatric psychiatry. Seniors have the same problems, plus a lot of anxiety, particularly in economic support. So the only reason I think it's the 4% number is there is basically seniors don't like to acknowledge that they have any problems with shrinking, which is the number I keep hearing.
I have to agree with that, Jim. I just want to add, we have a number of clients, 60 and older, that we try to approach the family member, the adult child, or the person, and they are so resistant to having an assessment just based on the cultural ages of why, and I'm this old, why would I want to, number one, find out something or change, or this is who I am. So it's, yeah.
How many of the referrals to urgent assessment come from parents, via parents, for the younger cohort? Good question. I mean, parents are all over their kids' helicopter and all that.
Yeah.
And so you would, whereas the reverse, for the older people, they're adult children. I don't care about it. So I'm not surprised. But the kids sort of have a harder time than adults do.
And another, you know, it's our culture of our time.
Yeah.
It's the kids' time, you know, now. Yeah, so it is.
But we'll see what happens. And again, is money, if approved, at 50, although I'll be quick to add, the average grant from AARP National is $20,000. My hope is that what we're doing is setting the awareness with a number of large national foundations, watch what goes on, and look for innovative programs, etc. That's what I'm really out to catch. However, if we can get this, it would be great. Reach 25 seniors, and more importantly, we'll raise the awareness level. So that's out, and then the telemed from Waveney, we asked for 25,000 for basically 10 seniors. Now, the problem is all this money has to be spent from June to November. It's another small amount of money. small window, et cetera, et cetera. But again, the real opportunity for both telemed and urgent assessment is the bigger fish that are out there. The other thing is to get acknowledgement from the state AARP that we are indeed the optimal livable community, which a term we've thrown around loosely over the last 10 years, but nevertheless, we've had.
Tom said, but not afford. Well, wealthiest, right?
Yeah, well, actually, the one thing I was thinking from the historical look at assessment, medical assessment, is that one thing that ties the wealthy communities together is high alcoholism. All the other stuff is iffy. Anyway, net is that the grants are in. We find out in May. Money would arrive on the stagecoach in June, and then we get to September. Well, actually, it'll probably be a stagecoach type device that will take a while to get. No, actually, they're good at using money. But again, it was a wonderful exercise. Wanted to acknowledge that far back in Boston and Alec were both involved in going to these meetings with the people at Waveney, Christine Friedman, and then several others there, and then Susanna Lewis from the Silver Hill operation. And then again, it's all it did for me was reaffirm, because anybody who wants to see the whole 7-page submission is welcome to either contact me or take a look at it here. But there's a lot of background that's part of this particular grant submission about what goes on in the volunteer level of the town, etc. All these little cues that they use at the community assessment. So I think that again, I was reaffirmed an understatement of what a wonderful place this is, and again, the fact that we could be putting 2 major innovations forth for seniors is something that I think is a worthwhile endeavor. I hope that they will both continue. So
Thank you, Jim. We'll see what May brings and keep our fingers crossed. Next item, New Canaan Urgent Assessment Update. Bethany, could you please give us a report on that?
Bethany,
she just stepped out.
The Meals on Wheels people.
Okay, all right, yeah. So we had, so New Canaan Cares with Judy Phillips was scheduled, but she called Monday and said that, or Tuesday, said she couldn't make it. So Bethany was fortunate enough to get Martha Lane and Meredith Landis, who have been involved. That's present president and past president of Meals on Wheels, to discuss what they do. So
They're here. Here they are. I'm here.
bringing me also.
Right here. Oh, right here. Sit here. Okay. So yes, we have Martha Lane, who's the current president, and Meredith Landis, who's the past president. Meals on Wheels, we do give them the grant request each year of $5,000, and it's just good to have information about where this money goes and how it's utilized from the community perspective. And thank you for all your basically labor of love for, you know.
It is a labor of love. Well, okay, so I'm the current president and have been for a couple of years. Meredith was 3 years as president, and we both had 6-year terms. And through the pandemic, I will point out.
Extended it. Like I was president for 8 years.
The pandemic makes sure basically being president was forever before and since. I'll always be the VP as far as I'm concerned.
Very good friend.
And with Bethany, obviously they just really took so many important people through this town, you know, to help in a way that families couldn't help, and people were so worried about. Bethany and Meredith just really they did every worst case scenario that we'd ever had. We always like, Meredith, why do you worry about these kind of things? And then they all happened. We lost our kitchen. You know, we have 1 million more people who need help. None of our volunteers can drive, you know. we would have people over 65 were our largest group of volunteers, but then remember over 65 were like, so Lamont's like, no one over 65. So we're like, oh good, we'll go to college kids because they're all home. And then that was good for like a couple of weeks. And it's like asymptomatic kids, don't let the college kids in here. It was just,
I was like, we can't use college.
and then we lose our kitchen, and then you guys could pick up the school, the high school to deliver. So basically, I kind of launched right into the pandemic kind of thing, but that does, I think, in a nutshell, it really revealed what the need is in this town, because we have about, you know, the numbers really vary on how many clients we have, because frankly, we have a steady, like 80% of our clients have been on for about 3 years, but that number, those actual people really roll quickly. And it's just, you know, because it's an aging population, that most people are over 70. We have people who kind of come in because their children who live in town have found that it's, like, as I did with my mother, that it's time to come down from 300 miles away. And then you know, you have people who were with right to the very end. I mean, we love our clients, and it's a constant reality that our clients die, and you know, that's just the way it is. So the truth is, though, we had about, I think we were up to over 60 at one point, but we had been more in the 40s leading into the pandemic. We definitely bumped up high, because it wasn't just people who needed our normal kind of services, but it was people who really couldn't get out and get groceries. And the town did such great stuff largely, but it really was very helpful that people could receive cooked meals every single weekday. Yeah. And so now, as a result of the pandemic ending, we have more people than we used to have. We have right now, like today, I think we've got 51, but month to month, we're averaging more like 55 for this year, or 21-22, not 55, which is up really from 40, I'd say, before the pandemic.
The highest we got was 44. So
yeah,
10.
You know, so we kind of expect it to be, and you know, that we're prepared for 60. Well, we're prepared for anything, because you know, we work with Waveney, which is fantastic. They just do so much for us, and it's just a great partnership. And they can do whatever we need. But we currently have 60, and our amount of people who are fully subsidized has really increased since before the pandemic. We subsidize everybody because we have these 2 meals a day, is a lunch and a dinner, however they want to do it. It's one hot meal, one sort of cold meal, and with a sandwich and the fruit and the cookies and the salad. But it's Monday through Friday. It doesn't matter if it's Christmas, Easter, Hanukkah, we always deliver. And we basically just make sure that whether you can afford it, can't afford it, you know, we take care of it. So everyone pays $9 for that, and the cost to us is $14. So every single person is subsidized by $5. And I would like to do a little shout out to Waveney, because I just keep waiting for them to increase their number, because inflation has, they're so good to us, and they'll do what they need to do, and we are aware, but we're constantly aware of the generosity and the support of Waveney.
People get it every day, or just one day a week?
We literally deliver Monday, Tuesday, Wednesday, Thursday, Friday.
51 people.
Oh, I see your point.
Are they getting 5 deliveries a week, or 1 a week?
We deliver every day. So if you were signed up to receive 5 days a week, and I thought that's what you're asking. Some people only want it 3 days a week. Some people want it 2 days a week.
You can get it 5 days a week.
You can.
And what would that cost them?
Well, it'll cost you from $9 to nothing. Yeah.
$9 a day.
Yeah. Okay. And the $9 covers the 2 meals.
Right. Unless there's a subsidy.
Yeah. And at this point, we are, I think as of today, we're like at 64% subsidy, which is really quite high for us. We, you know, Mayor, I think maybe under 50, but close to 50, when, you know, like about 3 years ago, the pandemic definitely
for different numbers, we don't really count those.
But 64 is a pretty high number for fully subsidized.
Very high.
And, you know, but we can handle it. We can handle it because of the generosity of the town. The town is amazing. I mean, the town itself is amazing, obviously, but everyone in this town is amazing. You know, we have about 50% by individuals. We have 30% grants. It used to be hire individuals to grant, but we just sort of moved one big individual sort of into the grant theory, because some people kind of equal grants at some level. But also, I think that what I've really noticed lately, since I've been doing something different this year, for the first time, I'm doing some site visits for some other organization. And so I'm looking at all these like 10 or 12 organizations that I've been going to. I am so impressed with Meals on Wheels, because what I really realized is we are so cost efficient. You know, we have one employee who works 3 hours a day, 5 days a week, and we do everything else ourselves. And really, it's the board. You know, we have 10 or 11 people who do the work. You know, we're not just bored and talking about it. And I keep on going to these other organizations, and you know, they want more money and all these things, and they want to hire another person. I keep in one, there was a board member there. I said, well, what are you guys doing? And she's like, well, we're the board. I'm like, I know, but I think, and I had to say, I said, I think you guys need to restructure. You're really not big enough to have a non-working board. You know, like that's the rule. You know, the rule is when you have, you know, like 2 or 3 employees, maybe you have that kind of money, you then can have a non-working board. We are a working board. We write our grants, we raise our money, we write our publicity. I mean, that's what you should do if you are us. If you're in a town like this where there's a lot of interested people with the ability and the time to do this kind of stuff. But it is amazing how many organizations maybe don't take as much advantage of the talent or the interest in the town as Meals on Wheels does. I mean, I think Get About does too. New Canaan is so great.
I know, isn't it?
Yeah.
And it all works together.
Yeah, and Get About is another great example.
Because if we have something and you deliver, and there's, you know, I'm walking downstairs and I'm like, it's too icy for me. I can't imagine what an older volunteer would do. I call Bethany, somebody goes out, they saw up the stairs, or we call.
And the volunteers are great
and
getting back to you.
volunteers.
So we get feedback through Meals on Wheels. Missing so-and-so, I mean, her apartment, like she's barely able to get to the door now, or she just wants us leaving it at the door when she used to be able to walk to the door. Can you check this out? Absolutely. So the referrals that come through us, or we find out that they do need Meals on Wheels, but I can't afford, the whole thing is just a great fluidity.
Yeah.
Do you have any impression how many people should be getting Meals on Wheels and aren't? In other words, how many people unserved?
Yeah, I mean, that's a Bethany question in a way, because we do everything we can to make sure everyone gets it, even if they don't, even if they're, sometimes we go to nice-ish houses and sometimes they're like, gosh, I wonder why they need Meals on Wheels. But that's not really the point. They maybe have a harder time shopping, or maybe they're widowed. Like the one lovely man, he literally couldn't cook an egg. Yeah.
Adult children want to be, you know, they feel they order the Meals on Wheels.
Yeah,
that's
all the time.
For it. Some reasons that people have tried it, but they're on a very specified diet.
We have just, you know, Waveney is extremely good about that too.
Yeah.
At the moment, we don't have that, but if we have someone who's gluten-free or salt specific or any, I mean, they are used to it, but they'll accommodate.
Also that changing the patterns of, but I always have this and that. Yeah. And but Meals on Wheels can't cater to every as a menu.
Well, that's true.
As a menu
we do get not always.
Yeah.
The problem is they don't love our salads. I don't love salads. I don't know.
Survey when they wanted us to order Chinese for them. We were like really scared.
Well, I will say,
yeah, it's just accepting that this is the menu for the day. Or not even menu. These are the meals for the day, and that can take some mental training as well.
How's the food? Have you had the food?
yeah, I've had the food because my mom actually was at, my mom has done the whole system. She was at the inn, she was downstairs the Waveney, she was upstairs the Waveney, and I ate there a lot. The food's great. You know,
so I can just interrupt for 1 second? We were redoing a computer system thing we had in, and we have a program that now works on a national level. Lots of Meals on Wheels across the country use it, and the woman who was training us came in and she sat down for the first time and ate. We were all having lunch at Waveney, and she ate the meal and she goes, is this what you serve your clients, or is this just for us? And I said, no, this is for the clients. I was like, I'm sorry, it's a little far. She said, do you know what other Meals on Wheels people eat across America? She was like, this is what you serve? I said, yeah. And she said, this is unbelievable compared to whatever. She said, it doesn't even hold a candle because you can't, nobody else serves this.
We're a lucky community. We're a wealthy community. So we are able to subsidize. And we have really a nationally recognized organization like Waveney that has an amazing chef. It's just the way it is. There's really,
It's a great town to grow
yeah,
up
it is.
Backyard, or, you know, the whole thing.
And I will only say that the one time they were uniformly happier was during the time at the high school. They didn't love the pizzas because we were working off of what was, but they were crazy about the chocolate chip cookies.
Yeah.
So I'm a big chocolate chip cookie believer, and I was like, at one point, I kind of meant to come in and say, could we just have chocolate chip cookies and make them so happy? But I kind of got distracted with other things. But you know, the other thing too is I think Mary would agree with this. Rebecca, you probably maybe you hear these kind of things, but a lot of times there is resistance to going on Meals on Wheels if you've been an independent person and you just don't like that idea of not cooking for yourself, or some maybe you think like, why do I need, I mean, I can afford things. Why do I, but I just, yeah, Mary used to worry about a stigma a lot. I didn't worry so much about it.
I think we're getting past.
Yeah,
It's getting better.
I think so. But I also, it's a symbol of decline in some people's minds.
It's grief.
It's grief for your past and for just movement forward in life. But what I was going to say, the happier, that's a starting point for some people. And then what I've really noticed, and we've all noticed, is, you know, we do have this thing, or I wanted to put on our bumper stickers, like, you know, we deliver love, but we do deliver love. So instead, you know, they said that's too hokey, so we have to write caring for our neighbors, which we also do.
Yeah.
But we deliver love and they like it because
I remember delivering once and you could just see, or several times, but they were waiting by the door.
Yeah, exactly.
Chat.
Yeah.
It was like their interaction. For
Our volunteers are the only people they see.
Right.
off some people, it's true.
I was invited to watch movies with them.
Oh, yeah.
Yeah.
And I gotta go to the next town.
Are weekends an issue because people want to load up on Friday with extra?
Yeah, well, we really do not deliver on weekends. It's always been an issue. Some people, like one guy in particular, we would love to give him food on weekends, but what we do is we often give him extra food because we always, not always, but sometimes we have an extra meal here and there. You know, someone forgot to cancel on us, and so we have an extra meal. We kind of know that. So we are aware because through Bethany, and then obviously through our own, like Miss Melissa Shapiro at Waveney is spectacular. And she is the heart and soul truly of Meals on Wheels. And she really knows what's going on. She does this because she cares about people. And she doesn't need, she comes down pretty far in her drive. You know, it's not easy. She had to overcome a lot of personal, I really can't tell you how much we respect her. Like she was not, her family didn't want her to get vaccinated. They were very opposed to that. She has to be vaccinated to work at Waveney. This was during the earlier, it was extremely stressful. And for her, in the first instance, she did it because she had, you know, she had to take care of these people. But then when the booster came around, she just was like, she just couldn't do it. So she did tender her resignation with tremendous reluctance. But we talked, and then I just want to say, Waveney I didn't know what we were going to do because no one could hire anyone in those days. Waveney was just like, don't worry about it, it'll be fine. I thought I'd be in there doing it, which was fine. but she, you know, like we talked about it, you know, brought some science people in, my son, to be honest, because he was like a biology guy. And she got herself there and did it. That's the kind of commitment which I thought was so impressive.
And she's amazing.
And as you know, but she knows everybody, she knows all their circumstances, and she takes care of people over the weekend.
But also the food bank, she'll say, like, Bethany will call up and the food bank will deliver and bring a couple of like some cans of food and things like that. So we all cover. And then also a few people adopt some of these people. So
yeah, you married was the first person who adopted you. I venture to say though that I don't think that anyone is going without food at any period of time. And
if we think there is,
if we had any thought of that, well, we do, because we're so lucky living in this town, is we're always looking for people who need more as opposed to trying to decide who can't get it, which is a different situation. Like I'm from Vermont, and in Vermont, I was, you know, I listen to the VPR for my regular news, and I am really sad to see what is happening, even in a pretty solid place like Vermont, where they've had to cut their Meals on Wheels clients. It's just, my mom delivered Meals on Wheels, is kind of why I got involved. I mean, it's just, there's a lot of need, and it's harder for volunteers, much farther distances. Everything's just harder. But we take very good care of our people. And, you know, we run a tight ship. We don't have the extra, you know, our budget's about 150, we've got about 150, we have like literally 600 left over in our budget. It just keeps working. I think there's, the donors that we have about 200 individual donors, and I used to do the annual fund. What I'm so struck by is how that donor roster just keeps changing. It's not the same 200 people. It's just like our clients. They just kind of roll through. They're aware. There's this consistent level of support in this town. I think we're doing a lot of good, and it's just a very important need, and it has to happen, and it does happen, and we don't have to.
We're grateful. I mean, this is one of the reasons why the grant requests, when you do turn one in each year, we're grateful.
Well, that's a nice way to put it. Well, I guess HSS, of course, we're doing the same thing.
Yeah.
Yeah.
The same thing.
I'm just wondering if we're giving you $5,000 a year.
Yeah.
What if we gave you 10?
You know what? This is where everyone gets annoyed at me as being head of. But I don't. I'm going to say it just because this is how my approach. We're fine with 5 right now. Okay. We don't need to give us 10. I don't want people giving more than we need. If we need more, we'll let you know. Yeah. We have
that's good.
Yeah,
that's a good.
Yeah, I mean, Mayor's.
I would change.
Yeah, see, Mayor and I have a different thing. Because Mayor was terrified that we would lose a kitchen someday. What do you do if you lose your kitchen? You do need to have money in the bank. We do have some money in the bank. It's, you could argue that it's never. See, Mayor's battle scarred and she really has PTSD. I mean, I've been 6 on the board, but she was present during the pandemic, but she was like this before. She was always so worried about losing the pandemic. And things can happen. I think we're okay. And I think that if we would tell us. Yes, and I think if we lost our kitchen, we would go out to certain people first before we would hit the town, and we would see.
Whether waiving is helping support this program more than they should.
No. No, look, kudos to all your volunteers that show up, and to you. We worked well together, and look forward to our continued working relationship. But it is such a great program especially for our seniors who are homebound and things of that nature. We hear about it all the time. So we'll do everything that we can to continue to support.
Yeah, and we do the accounting, which I always kind of wait for, where sometimes there's like an extra that we owe you because we have more clients, or sometimes we have fewer clients, so the price per meal goes up.
We'll add more cookies.
Yeah, but we have to ask these. We have to ask these guys for that. Yeah, I think those nice things. And the other thing, I guess the last thing I just would point out that's interesting, that you might find sort of interesting as a town, is our volunteers have reduced substantially, and by about 50%. That is just something that is happening in the world since the pandemic. People do not want to be tied down anymore. They really don't want to be tied down. And the community, like all the organizations, the church groups and all of them that we used to have, like maybe 15 volunteers from each, and we worked with those coordinators. We had to completely get rid of that structure. After Mayor went off and I came on, it was the first year after, I thought, okay, our mission is to rebuild community ties. Like, we had a mission statement. That was our goal for the year. I went and talked to all the churches, the clubs, trying to rebuild the structure that we had, as opposed to sort of like last minute, we are urgent, who's around. Even my church, Congregational, which was our #1 organized church, we just couldn't regain that commitment. They wanted to, they were trying. I mean, the leadership, I went and spoke. We have maybe 3 people from Congregational. We used to have about 15, 20. So we have a new structure, and we have a Sign Up Genius. We're all technological now, and they put that in during the pandemic. We have a different thing, about 100 who are on the list versus 150. We have 30, what we call angels, that kind of pulled this off, staying put, their idea of having the angel list. We use that now. We have holes every week, and we just shoot out this list of 30 people, and we always get someone to fill it. It's a different structure. It totally works, but it's just something that I think is interesting to note.
We also have Get About that we started. Get About has taken one route.
Get About has taken one route.
Get About. I think that would be.
Isn't STAR helping you as well?
Well, what I would say is that STAR is an opportunity for STAR to help us, and Get About has been great through the pandemic. Thank you. Through the pandemic, when we were really short on drivers, the Get About just totally saved our lives. I mean, it's like this. Get About needed to keep their people busy. Right. Nobody needed their services. They had hired people. We needed them. It was beautiful. Now they still take one route. you know, they can't always take it. With luck, they will get back to their normal thing, and they won't need to work for us. And with luck, we can manage it if we lost Get About. I love that we still have Get About. Having said that, you know, they will, I think they drive the star people, that kind of thing. So it's all very hand in
community integration.
Yeah.
Is there a generational thing with the volunteerism, like the older generations, because the tradition is what's going on?
Well, I would say
40.
It's Pilates.
I would say that it's not that. I would say it's sort of just like Meals on Wheels. Like people become more aware of Meals on Wheels, as I did when my mom, my mom came there to connect me to the inn, and then she also was just driving Meals on Wheels the day that we talked about it. And I was like, oh, I never even thought about Meals on Wheels here in New Canaan, whereas I was well aware of it in Vermont. So I think you get older parents, you get older friends, you start to be aware of it, you start driving. It's also true though that there's so much youth involvement because National Charity League, all these kids who have very civic-minded town, all these organizations, Slavs, these people are trying to get their children aware of how important it is to help people and how good it is for children to help people. And so we have a really nice generational thing. People do different things. Like we have this thing called Trade Touches, which we kind of started in a loose way. Now it's really pretty organized, where we try to have people from the classrooms or the Cub Scouts or National Charity League. They literally will make like poems or little flower arrangements, and they will bring them to with Melissa, and we'll put them out. We try to do about once a month, twice a month, kind of max. But that kind of thing keeps people involved. Sometimes they want to deliver more because on those days. And then we have moms with young kids who like to do it. I think around we don't have a lot of not as many 40s as you would think. 40s moms are busy. What do you think, Mary?
I don't know what the gap is and how that started. I just think that a lot of people just moved to this town who are younger. I agree with Martha. It's really, I'm working on Mayfair, and we're having a really hard time coming up with younger moms. And I hate saying that because I thought I was a young mom.
We're young enough, but no one's gonna call us young.
But I do feel like they're very busy. They're not in the routine, and maybe it will happen more when their kids start to go to first grade. I feel like we always talked about going and presenting to the moms of first and second and third grade, and
they're so busy.
They're so
Elementary. I don't think my view is, we're different presidents have different approaches or different things.
No, which is great.
Yeah, I just felt like don't even push these young moms. I see the moms with kids who are out at noon, like nursery school kids, and they are so sweet, and that is so great for the clients.
Too hard for them to get picked at.
And even on the board, the question often is like, shouldn't we get a younger board? And my view is, really, we do very well with people who are empty nesters and are looking for adding some youth. We want to be helpful and useful to people, and it is, these people are really great.
The reason I raise it is that you're certainly seeing with younger folks that everybody's busy, tons of time on social media. I know that sucks up too much of my time, especially younger generations, and there is connection crisis in general. People feel lonesome, and volunteerism has this amazing benefit that you don't realize until you're in
to volunteer.
I'm helping these people that I'm the one getting the real.
That's what I say too. That's what our letter says. Everyone says our volunteers say it is the best part of their day, their week, when they volunteer. And once you get people to drive, they get that. You're absolutely right.
We're super focused on behavioral health, but for me, this could be an interesting little initiative, just pushing volunteerism, because I do feel it's weakening.
It is weakening.
But we do put it out on New Canaan Moms, which is incredible. I don't know, I used to put it out on New Canaan Moms. You still put it out. We have a Facebook and an Instagram that Michelle used to make sure, but I think it could be pushed more. And that
she's gonna be president next if I have my evil way with
would help. I agree.
It's moms.
Yeah.
We're not all flies and get our nails done.
No.
That like many organizations in this town and nationwide depend on the unpaid labor of moms to function. And pre-pandemic, we were very willing to do it for a variety of reasons. And I think there was a reckoning during COVID, when people said, I'm working a full-time job volunteering outside of my home, making no money, not spending time with my children, and post-pandemic, people are just saying, I'm cutting back on that. My husband certainly would love if I would cut back on that. I've yet to do it, but I will say, I think many organizations are really struggling because all of this unpaid labor was done by women.
Yeah, so true. I agree with you completely.
Yeah.
So they have kids and they're working. And you can't work remotely now.
Yeah.
There are jobs available.
Yeah.
So you can multitask.
Casey, the health department went through the same thing when we, you know, in the beginning, everybody was gung ho, volunteering, you know. We were delivering and packing the food for Dr. Lutzi, you know, in the clinics. So now, and that's why I've focused last 2 years on the grants of paying the nurses and everybody, because unfortunately we had the same thing. You know, everyone wants to help, you know, but then when it becomes this ongoing thing.
Well, listen, I'm really great, but I that's why I don't blame any moms. I just feel like moms are doing their own thing. But what I mean, just to speak really plainly, when I say that we're having our volunteers drop, I don't think the moms are doing any less. I think they're doing about the same. I think it's people my age who are doing a lot less. And why is that? I think it's because they don't want to be tied down. They want to travel. They want to be free. And that's what I'm not happy about, because I kind of feel like, guys, you know, step it up. And also, if only for yourself, it makes you feel good. The moms have always been good. They're still good. They're not letting us down. I feel like it's my peer group that's letting us down.
Martha and Meredith, I'm Harrison Pearson. I'm sorry I'm not there in person. I'm the chair of Health and Human Services. I want to thank you so much for your presentation, and especially at the last minute. And I was reminded a little bit of when you mentioned about the stigma of the older people and not wanting to accept this. So my father, who lived until he was 99, and my sisters and other were preparing his meals. And I remember when my sisters said to him, they approached him and said, "Dad, how about Meals on Wheels?" And he said, "Well, I don't think I'm up to helping with that." And it was, you know, his point where he liked it just the way it was and didn't want anything else associated with it. You're welcome to stay for the rest of our meeting, because one of the issues on or one of the items on the agenda is commissioners' activity in the community. And we did speak about this in January. We spoke about, you know, possibly becoming more hands-on active. And Barb sent an email and has some forms related to this, you know, like helping with the food pantry, visiting isolated seniors. Of course, we do that in conjunction or with the okay of the HHS, who knows all the people involved. And Barb recently mentioned doing this with Meals on Wheels too. And I guess there are some possibilities this summer or whatever. So Barb, you want to...
Here, coincidentally. I know you guys were coming, and I said, this is an opportunity, and I went online to try and find some times, and the slots were pretty well taken. But just to Harrison's point, I think for us to get out in the community, like we delivered this. So if anybody's interested, we can get some space in June and July. You go as a team, so 2 people would go together. We could find a day, maybe I talked to Shona and Jen, maybe a day where 4 of us could go or something like that. So if you are interested in being hands-on doing this, I'm just gonna pass this around.
In case you don't do enough.
You know, it's wonderful. You know,
yes. I mean, I'm definitely interested, and I think others who have the time and schedule and what have you can be involved with that also. And then and there's also the other things too, the food pantry, which is ongoing, and visiting the isolated elderly. And the next item, which I want to do before we run out of time, is Jacqueline DeLuey has been honored, and in a way, the Health and Human Services is honored too, because the Domestic Violence Crisis Center is given a luncheon, and they're going to honor Jackie. And so, you know, those of the commissioners who have the time and schedule works, you know, more than welcome to come, and we hope you could find the time to do that. I am going to do this. I think Barb is definitely going to do it. Bethany, Marcy will be there, and whoever else wants to be involved. The town does not pay for things like this. It is $150 per person, which is a very good cause. So it's just an FYI. It is scheduled for May 18th from 11 to 2 at Tokenie Club in Darien. So you can give that some thought. And anything else of import?
I would just say volunteerism, because we used to have hundreds of volunteers, as most of you know. Volunteerism is way down, and we've had a lot of people move out of this town with new people coming in. But volunteerism, even for younger kids and for people that just retired, is way down. So anything we can do to try to bring attention to that. Millsville has done an excellent job in finding additional volunteers and people to jump in. But it is becoming we rely on volunteers, this town does, for a lot of programs, including this one.
Yeah.
It may be a mentality, et cetera, but COVID had to have played a role with some of this. People who were volunteering did not want to be exposed. So
one other thing, I neglected, and I would never be able to go to sleep tonight. Greg Riley was critical in this AARP grant writing thing as professional. And most importantly, he got money 2 years ago from this foundation, so we're hoping to remember him in Washington. But he was critical. So that is one of the good investments this town is making, to pay the grant writing.
Well, the minister like he forgot.
Thank you, Jim. It is that time. May I please have a motion to adjourn?
Motion to adjourn, somebody?
Second,
all those in favor, aye. Thank you so much again for coming this morning. I hope to see you in person next month.
Feel better that we have Millsville